Okay, as far as the syllabus goes, we are done with the hematology section, at least as far all the topics which you have to perform in the exam. Some topics are there like ESR, PCV and platelets, which you are not to perform during the exam. If it is possible, we'll demonstrate to you, just you will know just something how it is stained and all, ESR, PCV, what are the instruments, or we'll show you the instruments. But as far as the topics you have to perform in the exam, they have been done. The clinical physiology part, human clinical and human physiology part, we have done the different systems, cardiovascular system, history taking, general examination, cardiovascular system, respiratory system and examination of the abdomen. These have been done. Now measurement of, along with the clinical physiology, side by side you have seen the instruments, measurement of blood pressure, whatever instruments we have required till now. Okay, stethoscope and blood pressure, except this I don't think have we used any instruments. So you are seeing the instruments side by side. So there may be, if the examiners want, there may be a separate table for identifying instruments and there will be some marks allotted for it. These are the instruments you have seen in your whole curriculum. So maybe 5 marks allotted for a separate table, maybe that is kept, or sometimes nowadays it is kept as a part of the objective structure practical examination, which you have not faced till now. You will face in the, I think in the next exam, or we'll just give you examples, or we'll just show you how it is done. So next left is the in clinical and human physiology, nervous system physiology, and what is left is very brief. We will discuss the amphibian physiology. So we start with amphibian physiology. It is nothing separate. It should not be called amphibian physiology. Amphibian experiments which demonstrate these simple things, like some things of nerve muscle experiments, some cardiac experiments. Now nowadays we don't go with that. You don't have to perform the experiments on your own. Just what are some observations we make, those observations you have to know about in the exam. In the exam you will face maybe 5 to 10 marks on it. There will be certain charts, or you will be asked to, this may be asked orally, this may be a part of the viva examination, or there will be separate 5 marks, 10 marks, and there will be certain charts. You will be asked to identify the diagrams and explain it. Okay, this will be from the exam point of view. Now very briefly speaking, it requires an apparatus. Amphibian experiments we choose, that means the amphibian, that is the animal chosen is usually the frog. Okay, because these are cold-blooded animals. Okay, sometimes these are asked in the exam, why the frog is chosen for these experiments, because it is easy to handle, these are viable, availability is, that is especially in our countries, availability almost throughout the year available, more in the monsoon seasons or the wet seasons, but almost available throughout the year. So these are the reasons we choose the frog as the experimental animal. They are harmless and all, but now due to ethical issues and all, even in the MD syllabus they are not, most institutions are not encouraging the experiments just for the purpose of this learning and education. So actually these are not done, more or less these are not done these days. Actually, if we do the experimental setup, actual experimental setup, it is easier to understand. But the basic thing is that, so there will be electrical impulse on the, in case of nerve muscle, electrical impulse to the nerve will induce the muscle contraction. So that electrical impulse requires an apparatus. A mounting apparatus is there for mounting the nerve and the muscle preparation. Which nerve is chosen? The sciatic nerve is chosen, and the associated gastrocnemius muscle. As you know from your knowledge of inferior extremity, it is a muscle in the which region? What muscle? Gastrocnemius? Posterior part of gastrocnemius, posterior part of leg, posterior, that is the calf muscles, not the calf, not the thigh. So sciatic nerve is a long nerve, so you can tell the course better than me now. Sciatic nerve is a long nerve. So posterior part of the, so it is one of the calf muscles. So that preparation is chosen, the mounting is done, and there is a apparatus, you don't have to write, it is given, whatever practical books you have, the name is mentioned, the pictures are given. Actually the experimental setup is described in the practical books. The Dubois-Reymond induction coil will not go into the details. Usually this is used to induce an electric current. So the nerve is stimulated. The principle is that the nerve is stimulated and the muscle contraction will occur. Now that flicker of contraction which occurs, or simply called the muscle twitch, flicker of contraction may be even 1/100 parts of a second. It requires, or slightly greater than that, 1/80 parts, so very in fractions of seconds the whole thing will be complete. But there is an arrangement, a lever arrangement, a stylus which draws over a arrangement called the Kymograph. So the Kymograph is rotating, so a lever system is there, and the stylus draws a, say, white lines over the, as the muscle contracts, the line is drawn. So it looks something like, as the line is drawn, in one case of simple muscle twitch, in case it looks something like this. So the nerve is stimulated, and when the muscle is contracting, it is attached to the stylus, the lever system is moving and it is drawing this line. It more or less looks like, you have seen, it has nothing to do, it is separate from the action potential, it more or less looks like that. It is a curve that looks like that. But it is not that depolarization after polarization, it is showing that muscle contraction phase says it is showing. It is not the repolarization of the nerve. Okay, it looks like that. It is similar, just similar looking. So this phase is actually denoting the contraction phase, and this phase is denoting the relaxation phase, when the muscle is relaxing. And this cannot be, actually humanly this cannot be intervened. So as soon as the nerve is stimulated, the process is so fast that this cannot be humanly intervened. This just, the arrangement is made such that after a single muscle contraction, unless a second stimulus is given, if a single stimulus is given, only this is recorded, this can be seen. So from your exam point of view, only this part will be asked. So just see it, you have to see it and describe what it is. So this is a simple muscle twitch, and in the arrangements are made. So this, there is a wave in just below it, that is for time tracing. A tuning fork is used of frequency 100 Hz. Sometimes these are asked just verbally, that what frequency tuning fork is used for recording this, the time taken. So you see, it is written LP. This is the, actually the LP is also called the latent, also called, means the meaning of this is latent period. That is just after the nerve is stimulated, some time elapses before the muscle contraction starts. That is the latent period. Now what happens in that period, from your knowledge of neuromuscular physiology? Actually what happens? What is the physiological cause? That there will be a very small gap. Now again, this is humanly not recordable. This is a 0.01 second. Okay. So how it is, you cannot measure it with your whatever you have, stopwatch or whatever. So it is 0.01 second. But what is the reason for that? Just after a nerve stimulation is occurring, then the muscle contraction is occurring. What is the reason? There is a certain gap. What is happening at that time? What is there in the so that is the neuromuscular junction. What is there in the neuromuscular junction? Acetylcholine. So that has to act. So that phase is the latent phase. So latent phase. After that, the actual muscle contraction starts, and that is the contraction period. This records, the highest point records the amplitude of contraction or the height of contraction. So this increases, this height of contraction increases if the muscle, this is a simple muscle twitch, we are under experimental conditions, we are trying to first record it at the room temperature. So if it is done at 40-45 degrees centigrade, this height of contraction increases due to the enzymatic reactions and fast and all, what are the changes in the muscle physiology due to temperature. So what will happen? It will start earlier, the latent period will decrease, and the height of contraction will increase. Again, if it is done at a, say, cooler temperature, around say 10-15, maybe up to 20 degrees centigrade, then the latent period is slightly longer. It takes some time for the after the nerve stimulation, but that sometime we are saying that is not again humanly not possible to measure, but it is shorter than what is it is longer than what it is room temperature, and again the height of contraction will be lower. So if in the same curve, if on the in the same way, so if this point is again used, if the stylus in the experimental arrangement, if the stylus lever stylus arrangement after arranging for a different temperature, if the stylus is again moved to the same point and then the nerve is stimulated, it will be seen that the contraction starts maybe for say at 10 degrees centigrade. The contraction starts maybe here and the amplitude is low. So this point becomes here, and if it is started, say again it is stimulated here and at a warmer temperature, warmer means above room temperature, above 40-45 degrees centigrade, maybe this contraction starts here and it is higher. This is what you are recording. You will be asked simple things from the exam point of view. You will be not asked about the experimental setup. Just remember the word, see in your books, the diagram is given. Just remember the name of the instrument. What instrument do we use for the setting of the current? Dubois-Reymond induction coil we use for setting of this current. There are parts of the instruments, the way we handle the instruments in some, there are some recordings where we have to switch off the primary key and all, but details are not required. Just know that this is the simple muscle curve for one single stimulation, varying its single stimulation, varying the temperature. We can record on the same portion also. We have to just, so we can use the identically same point of stimulus. So this is called the point of stimulus. If this is asked, what is this point, you have to say this is the point of stimulus. So if we use the identical point of stimulus, then we will see the variations with the temperature. Now what happens is that if we give a second stimulus, and that has to be again experimentally set up, that we will apply a second stimulus. You see a second stimulus within the latent period of the first stimulus. Now again it is not humanly possible. You can understand that I cannot measure the latent. So I give a stimulus, even if I try to give a second stimulus mechanically, after that at least 2 seconds, 3 seconds will be required. So second stimulus within the latent period of the first stimulus means it is already set up, that it will be automatically, the setup is done earlier, so that a second stimulus is given within the latent period of the first stimulus. So if it is a stimulus of the same strength, then what it is seen within the latent period, or better first call it within the first half of the latent period, then there is no change is seen. So it is recorded as a same simple muscle twitch, because the muscle at that time is totally refractory to a second stimulus. But if we give it the second half of the latent period, then there may be some changes seen, just maybe just a bit of height of contraction may be raised. If it is given within the contraction period, then what happens? If it is given within the contraction period, it just, sorry, so just what happens here, like this, recording like this is seen. So it marks the another stimulus, the recording of that is another stimulus is given, and then more or less it curves the same height and it relaxes. As it relaxes normally means it is, the figure comes as it is. So if it is a second stimulus within the first half of the the contraction period, but if it is in the relaxation period, then a separate single muscle curve, similar curve for the second one is achieved, and this is sometimes called the, sometimes not, this is called the beneficial effect, that already one contraction is going on, another contraction is facilitated because of the same strength. The second stimulus has to be of the stimulus of the same strength. But if this is of the same strength, so if the same strength of stimulus is given to the nerve, that is electrical stimulus, then a similar should be recorded. But if it is within the similar SMT should be recorded, but if it is within the latent period, the muscle is still not able to identify that stimulus. This is the theoretical background. If it is the increasing stimulus, then there will be different observation. If it is the same stimulus, then this will be this type of observation. But if it is a different stimulus, then the height of contraction will obviously increase. Okay. If it is a higher stimulus, even if it is the same latent period, the height of contraction will be increased. And as the frequency of stimulus goes on increasing, very less frequency, obviously again experimental setup has to be prior. We cannot do it. We cannot mechanically do it at that time. It is a very low frequency. You can understand that 0.01 second is so less. So measuring lesser than that, so it is impossible. So then what will happen? Then the muscle either gets, after a certain limit, it will get fatigued. But before that also it will pass through some stages, like those are called clonus. Still it will contract to some extent, and one time will come when it will be go into a state of sustained contraction. That means it is not visible, that these contractions are not visible on these diagrams separately. So sustained contraction, it will form a straight line like this, which depicts that it has got into a state of sustained contraction, which in theory we call tetanus. Okay, tetanus. In theory we call it tetanus. So first clonus, then tetanus. This is due to increasing strength, increasing frequency of stimulus, and increasing strength of stimulus, increasing frequency of stimulus. Now, just you see, in the exams you will get diagrams like this. In the books you will read similar diagrams. In the exams it will not be written. So you have to tell what is point A here. Just say the point of stimulus. So the AB is latent period. So point B is the start of the contraction phase. BC is the contraction phase. CD is the relaxation phase. Now you can see this thing which is drawn on the board. There is one very small curve at the end. Everybody can see one very small curve at the end. So that is called the physiological curve. Now remember, if you are to ask to explain this, you just say this is somewhat a bit of a misnomer. This has nothing to do with muscle physiology. This is not actual contraction or relaxation. Okay. So don't think that the muscle is again contracting and relaxing, so this curve is obtained. This physiological curve is due to, if you have to say in one word, just say the inertia of the lever. We know from physics, you know inertia. What is inertia? So there are a lot of dust particles on a piece of clothing. We beat a clothing, or better examples are, say, when we are trying to alight from a moving bus. So these are the examples in physics. So it is better that it is better not to alight for safety. But if you are alighting, then do it in the direction of the bus and try to run a few steps, because the body tends to move. That is due to inertia. These are examples of inertia. So this is the inertia of the lever. So this muscle recording, everything has stopped, but the inertia of the lever just draws this small line. This looks like the same curve, but this has nothing to do with actual muscle contraction, relaxation, muscle physiology. But somehow when this was seen, somehow this was named by somebody as the physiological curve, and this is still named so. That is a type of misnomer, at least in my opinion. In the books it is written, it is called the physiological curve. It is not due to muscle contraction and relaxation. This is due to the inertia of lever. So you have to tell that this is the physiological curve. Or maybe say as a MCQ option you get that physiological curve is due to muscle, due to a small another flicker of contraction, second flicker of contraction. So you take that option is wrong. Or physiological curve is seen when we record a simple muscle twitch. That option is right. Okay. So you are given 4 options. Say you can be provided these MCQ type of questions in the objective structure practical examination also. So physiological curve is seen during recording of a simple muscle. This is a true option. But physiological curve seen during simple muscle twitch is due to actual muscle contraction. This is false. So physiological curve is due to inertia of lever. That is true. Okay. So this is called the physiological curve. This one you may pass and see. তোমরা দেখো সবাই যেন দেখে. So this is due to higher temperature. So usually in the exams, this is due to higher temperature, 40 degrees centigrade. Pass it. This is due to higher temperature. Yes. ওইটা পরেরটা. This is due to higher temperature, but in the exams you will have diagrams where it will be in the same diagram. There will be at 40 degrees centigrade, 10 degrees centigrade. So there will be at least three curves, and you have to identify. Obviously nothing will be written, it will be like this. You have to explain the curve. So this is, if this is given, it is pretty simple. One simple muscle twitch compared with another at higher temperature. Like this is at lower temperature, this is at lower temperature. Pass it on so that everybody can see. So this is at lower temperature. So in the exam usually it is a combination. So somebody has the book by Dr. A.K. Jain. I don't it should be given in all the books. So I have seen that diagram in that book. Does anybody have the book by Dr. A.K. Jain? So if the temperature decreases, I think it is given in other books also. If the temperature decreases, latent period increases, amplitude decreases. If the temperature increases, latent period decreases, amplitude increases. So I think similar curves are given in other books also. So if it is the, so this you can see, this is the increasing strength of same strength stimulus given at different periods of the first contract, that is within the latent period or outside the latent period, that is during the contraction phase, during the relaxation phase, after the relaxation phase. If it is after the relaxation phase, then it is almost like that another simple muscle twitch, only that the height of contraction of the second one is greater than the first one. This is called the beneficial effect. Just note the which is being passed. Note the second figure. I don't know whether it's another arekta ache kina. So see, this first one is a simple muscle twitch, and jeta dewa ache setai. This first one is a simple muscle twitch. Second one is after the relaxation period, but the second twitch has a greater amplitude of contraction. So this why it is called the beneficial effect. And even if this is the within the contraction phase or the relaxation phase, so it looks like it is one curve, but one amplitude, that is one height of contraction, but that is greater than what would be in case of a single stimulus. So this is a same stimulus strength, second stimulus, which is causing the beneficial effect. So the height of contraction is more. Latent period is same. Temperature has not changed. Here temperature remains. If the temperature also changes, it is, say the temperature also increases plus the same stimulus, then it will be a greater height of contraction, greater than this also. So without other factors constant, we are studying the same stimulus, second stimulus of same strength. Okay, pass karo ota in the different periods. Now one thing to remember is that if we go on increasing the strength of the stimulus separate at different currents, so we will record a higher amplitude increasing the strength of the stimulus, but there is a certain limit to it. Now what happens physiologically is motor units are being involved, more and more motor units. Now a time comes when there is a stimulus, all motor units get involved. So there is a height of contraction. It is greater than obviously say a very small stimulus or a medium stimulus. So stimulus is going on increasing, the strength of the stimulus. Now height increases, but it up to a certain limit. That means after that, even if the stimulus goes on increasing, we are getting a constant height. That is because all motor units have been recruited, and these motor units follow the all or none law. It is not like that when the 50th motor unit is being recruited, the 20th motor unit has not worked up to its full potential. So each motor unit, after working up to its full potential, then only another motor unit will come into action. So 1, 2, 3, 4. So just giving arbitrary example, the numbers are arbitrary, so that 50 motor units are involved, say. So it is not that if for the 49th one to be active or to be working, all 48 must have worked up to their highest potential. So if after that it is not increasing, why? Because all the motor units have worked up to their full potential, so the amplitude of contraction is not increasing. And this is demonstrated not by this full simple muscle curve, this is demonstrated by producing something called the make or break current. Details again you don't have to know. Okay, make or break current. So this looks something like this. Just the amplitudes are recorded. One time comes when the amplitude is no more increasing with the increasing strength of stimulus. So the lowest stimulus at which the maximum height of contraction, we are noting, we are giving increasing strength. So 10, so say the stimulus strength are just again the numbers are arbitrary, say 5, 10, 15, 20 like this. So we give then 25, 30. So maybe say now the stimulus strength is 40. Now if the stimulus strength is 40, we are getting a height of contraction, then 45 same height, 50 same height, 55 same height. Now this lowest value at which these same heights are produced, this is the maximal stimulus. Now this is designated as the maximal stimulus. Above them they are called the supramaximal stimulus. Why that is called the supramaximal? Because that is greater than the maximum stimulus, it is not causing any increase in further height of contraction. Subminimal will not cause any contraction, minimal no contraction, or just slight, then certain contractions are increasing. So very simple things will be asked from this part. So one time comes when the height of contraction is not at all increasing. This is the supramaximal stimulus, height of contraction no more increases. ওইটা বলছে, বাট দ্যাট হ্যাজ টু বি এক্সপেরিমেন্টাল সেটআপ আর্লিয়ার। আমি তো করার সময় তো দিতে পারবো না। তো এই চার্টটা এখানে নেই দেখছি এখন। দিস ইজ দ্য দ্যাট টিটেনাস। এই বইটা দেখো, যে বই থাকবে আছে, যখন সাস্টেইন কন্ট্রাকশনে চলে যাচ্ছে ডিউ টু ইনক্রিজ ফ্রিকোয়েন্সি, দিস ইজ শোয়িং দ্য টিটেনাস। ইন দিস বুক ইট ইজ পেজ 105। আর যদি অন্য বই থাকে দেখো, জেনেসিস অফ টিটেনাস, ক্লোনাস টু টিটেনাস, টিটেনাস অ্যান্ড ক্লোনাস। ছবি নেই, তাহলে ওই বইটা থেকে দেখে নেবে। I think everybody, as I go on telling, that is all books, you can read any book, but some things, one or two things may be missing in one or two books. So I'll tell that whatever you will be asked in the exam from amphibian physiology, everything, everything written in books will not be required. You don't have to study about the experimental setups and all. Just read the whatever diagrams we are discussing, just see those diagrams and the explanation of those diagrams from the book. I'll recommend again the same book by Dr. A.K. Jain. That is the book by Dr. Anyway, he is telling that the diagram for tetanus is not there. So sustained contraction, as we go on increasing the frequency of the stimulus, at a time it goes into a state of sustained contraction. See this also, this beneficial effect, if the same stimulus, sometimes this can be given showing the beneficial effect, and also if the increased strength of stimulus. So it is showing in the same diagram. Maybe this is given, obviously then the writings will not be there. সবকটাই বইতে পাবে। আই থিঙ্ক দ্যাট আমি যেটুকু দেখেছি ওই বইটায় যেটুকু দরকার তোমাদের, যেটা জিজ্ঞেস করা হয় পরীক্ষায়, সবকটাই আছে। ইনফ্যাক্ট এক্সপেরিমেন্টাল সেটআপটাও আছে, সেটার দরকার হবে না। জাস্ট ডুবয়েস রেমন্ড ইন্ডাকশন কয়েল ছবিটা দেখে রাখবে, যদি পরীক্ষায় কোনো সময় ইনস্ট্রুমেন্টের নাম জিজ্ঞেস করে, যদি সবগুলো না পাও, যেটা যেটা হলো, একটা হচ্ছে সিম্পল মাসেল টুইচ, একটা এফেক্ট অফ টেম্পারেচার, বেনিফিশিয়াল এফেক্ট, এফেক্ট অফ টিটেনাস, effect of tetanus, na? Tetanus, that is, one is this maximal supramaximal stimulus, আর একটা হচ্ছে genesis of tetanus। এরপরে লোড পরের দিন হবে, লোড, আফটার লোড, জেনেসিস অফ ফ্যাটিগ, ওগুলো আছে 7-8টা আছে ইন নার্ভ মাসেল, সেই 7-8টা এ নিয়ে দেখে নিই and read that from there during the exam. We usually take 4 or 5 weeks, আমরা আশা করি এটা বেশি টাইম নেব না। এরপর আবার সিএনএস বাকি আছে, 5 নম্বর থাকবে সাধারণ, 4-5 উইকস নয়, সরি 4-5 ক্লাসেস। অ্যাকচুয়ালি এই থার্সডে উই হ্যাভ আ হলিডে, সো এই সপ্তাহে তো আরেকটা পার্ট হয়ে যাবে, তোমাদের হয়ে যাবে, আবার ওদের মানডেতে হবে। তারপর নেক্সট উইকে একটা ফ্রাইডেতে আবার একটা হলিডে আছে, তো সুতরাং সেদিন তো অন্য ব্যাচের ফিজিওলজি আছে। তারপরে আবার পয়লা বৈশাখে আছে, সো দ্যাট ইজ আ ওয়েডনেসডে। সো তার আগে উই উইল কমপ্লিট অ্যাম্ফিবিয়ান ফিজিওলজি। দ্যাট ইজ মেক কারেন্ট অর ব্রেক কারেন্ট, ডিটেলস লাগবে না, মেক কারেন্ট অ্যান্ড ব্রেক কারেন্ট। সো ইউ ক্যান রিড ইট ইফ ইউ হ্যাভ, মানে ইন্টারেস্টিং যদি মনে করো যে পড়তে ভালো লাগছে, ইউ ক্যান রিড ইট। সো হোয়াট এভার ইউ ডোন্ট হ্যাভ টু, দ্যাট ইজ দ্য এক্সপেরিমেন্টাল সেট আপের, যে কখন প্রাইমারি কি সেকেন্ডারি কি, দেন ইউ হ্যাভ টু, মানে দ্যাট ইজ বেটার, যে তার মানে যদি হোল এক্সপেরিমেন্ট আমি নিজের হাতে যখন করছি তখন তাহলে বোঝা যাবে, এটা থিওরি পড়ে বোঝার এ নয় আর। You will be asked to explain, you don't have to, you will not be asked to explain about currents, how this experiment is set up, সেইগুলো যে এই অবজারভেশনটার উপরেই কোশ্চেন করা হবে, যে এই সুপ্রাম্যাক্সিমাল স্টিমুলাস তাহলে হাইট অফ কন্ট্রাকশন বাড়ছে না কেন, বিকজ অল দ্য মোটর ইউনিটস আর অলরেডি রিক্রুটেড, বা and this muscle contraction follows all or none law, এমন নয় যে I have 50 motor units recorded, so the first motor unit now again can make some contraction, সেটা যেহেতু হচ্ছে না, already the earlier motor units have already worked up to their full potential. This is the cause that no more contraction is happening. টেম্পারেচার বাড়লে কেন হচ্ছে, এনজাইমেটিক রিঅ্যাকশন ফাস্টার হচ্ছে, টেম্পারেচার বাড়লে কি কি ফিজিওলজিক্যাল মাসল চেঞ্জেস হয়, so that is due, so that have amplitude of contraction increases. এফেক্ট অফ, ঠিক আছে, এটাও সাধারণত নেয় না, দিস ইজ বেনিফিশিয়াল এফেক্টের জন্য ওই ডায়াগ্রামটা, যেটা ইন রিল্যাক্সেশন পিরিয়ড, ইন লেটেন্ট পিরিয়ড, ওইটা দেবে, নট দিস ওয়ান, ইউজুয়ালি এটা দেবে না। তাও জেনেসিস অফ ফ্যাটিগ এর পর বাকি আছে, ওইটার সঙ্গে এটা, সো এটাই লেখা আছে টাইম ট্রেসিং 100 হার্জ, দ্যাট ইজ, ইউ মে বি আস্কড দ্যাট হোয়াট ইজ দ্য ফ্রিকোয়েন্সি ইউজড ফর টাইম ট্রেসিং, ইউ উইল সে 100 হার্জ ফর দিস এক্সপেরিমেন্ট, 100 hertz tuning fork is used for time tracing. So left is এরপরে preload after load এর একটা আছে, load, effect of load. So preload after load you already know from your cardiac এ কি হয়, যে preload which is সেরকম মাসেলেও before the contraction starts, এটা পরের দিন হবে, and genesis of tetanus, preload after load, এরকম আর velocity of nerve impulse, এই 2-3টে কারবার আছে। So that will be done on Saturday, and start reading the topics. I will recommend that if you pick up that book it will be easier, otherwise অন্য বইতে at least দেখে নেবে যে ছবিগুলো যেন সবকটা দেখায়, কারণ ছবিটা দেখেই এক্সপ্লেন করতে হবে পরীক্ষায়। এখানে এক একটা বইতে এক এক রকম ছবি থাকলো, আমি নিজের মতো পরীক্ষায় আঁকলাম সেরকম তো নয়, বা স্কিম্যাটিক ডায়াগ্রাম নয়, যেরকম ছবিটা আছে সেটাই তো, সেরকম ছবি পরীক্ষায় দেবে, জাস্ট নামগুলো লেখা থাকবে না, হোয়াট ইজ দিস বেনিফিশিয়াল এফেক্ট হেডিংটা লেখা থাকবে না, ইউ হ্যাভ টু এক্সপ্লেন। সো একটা ভালো ছবি যে বইতে আছে সেটা ওই বইটা দেখে আসলে ভালো হয়, দেখে নেবে যে প্রত্যেকটা টপিকের ছবিগুলো আছে, ঠিক আছে। এটা পড়ে নাও, অ্যাম্ফিবিয়ান আমরা স্যাটারডেতে আবার, এটা নার্ভ মাসেলটা আশা করি কমপ্লিট হয়ে যাবে, নেক্সট উইক কার্ডিয়াক কিছু আছে, উইল ট্রাই টু কভার অ্যাজ কুইকলি অ্যাজ পসিবল অ্যান্ড দেন মুভ অন টু পালমোনারি আর্টারি বেরোচ্ছে রাইট ভেন্ট্রিকেল থেকে, কিন্তু এওটিকটা অ্যাকচুয়ালি রাইট সেকেন্ড ইন্টারকোস্টাল স্পেস, পালমোনারি এরিয়াটা লেফট সেকেন্ড ইন্টারকোস্টাল স্পেস। কারণ হার্টের স্পেসিমেনটা যদি মনে করো, এটা তোমরা তো রিসেন্টলি দেখেছো নিশ্চয়ই, তাহলে দেখে গ্রেড ভেসেলগুলো কিভাবে অ্যারেঞ্জ আছে, ওইখানে রাইট আর লেফটটা উল্টো, মাইট্রাল আর ট্রাইকাসপিডটা একই, এটা দুটোই অ্যাকচুয়ালি লেফট ফিফথ ইন্টারকোস্টাল স্পেস। এটা হচ্ছে মিড ক্লাভিকুলার লাইনের একটু ভেতরে, যেই এরিয়াটা এপেক্স বিট বলছি ওটাই মাইট্রাল, আর ট্রাইকাসপিড এরিয়া স্টারনাম থেকে একটুখানি ভেতরে। এই চারটে জায়গায় খালি স্টেথো বসিয়ে সাউন্ড শোনা, যে এটা মাইট্রাল আর ট্রাইকাসপিড এরিয়া ফার্স্ট হার্ট সাউন্ড বেটার শোনা যায়, আর পালমোনারি আর অ্যাওর্টিক এরিয়া সেকেন্ড হার্ট সাউন্ড, যেটা হয় আর কি ওখানে। তো সেকেন্ড হার্ট সাউন্ড ডিউ টু ক্লোজিওর অফ সেমিলুনার ভালভস, ফার্স্ট হার্ট সাউন্ড ডিউ টু ক্লোজিওর অফ এভি ভালভস, তাই তো? সেটাই, ওইটুকুই খালি মানে হার্ট সাউন্ড শোনার এক্সট্রা, আর বেশি আছে রেসপিরেটরি সাউন্ডে ব্রেথ সাউন্ড, সেগুলো তো করি